Okay. Good evening, everyone. Thank you very much for coming on yet another edition of Your Billion Dollar Body. We are so excited that you are participating with us this evening. Thank you very much, everyone, for joining wherever you're connecting from. The show that you all have been waiting for is back again. Yesterday, we had one session, and today we are having the concluding part of that session on fertility in both men and women. And in that topic, Dr. Dolly and Madam Rosling, they actually have dealt with it judiciously. They have spoken about treatment, prevention, and understanding fertility or infertility in men and women. Now, don't forget that this show is proudly brought to you by Salad Master. Thank you very much, Salad Master, that healthy cooking company that ensures that your food is healthy. Now, we're going to have live pictures coming through shortly because we have in the studio this evening Dr. Dolly and Madam Rosalind. Thank you again. Just to mention that we are streaming live on YouTube, just in case you have people who you have sent the link to and they are joining us on YouTube, they can actually click on the subscribe button and also click on the notification bell. Thank you for joining us. We're so excited that you are with us this afternoon or this evening or this morning. It depends on the country that you're watching us because we're global right now and we have people connecting most of the time from UK. We have people connecting from all around the world. So thank you very much. We're excited that you are here. Now, those of you who are on Zoom, you can ask your questions using the Q&A button. For most devices, it's just on the floor of your screen. And for some other devices, it's on the top of your screen. Just click on that and ask all your questions relating to fertility or infertility today. And also, if you're on YouTube, you can ask your questions using the chat area of the YouTube channel. And we are going to get all your questions. Thank you so much. We're so excited that you are here. We're going to have pictures coming through shortly. We have pictures. We have live pictures. Hello, Dr. Dolly and Madam Roslyn. How are we doing today? I hope you can hear me
Hi,
clearly.
Marvel.
Okay.
Yes, we can hear you clearly.
Right. I was just saying that we started an interesting episode yesterday, and today we are having the concluding part. We have people who are waiting just to see this show. So I'm going to hand it over to you guys. Without further ado, over to you now in the studio. By the way, both of you look amazing tonight.
Thank you, Marvel.
Thank you, Marvel.
Okay, so good evening, viewers. This is your favorite program, Your Billion Dollar Body, and here we are in our another branch, which is located in number 2 Alexander Street, Ikoyi. This is called the Shekinah branch. You can walk in and have a feel of what Salad Master does. This Billion Dollar Body is brought to you again by Salad Masters. And with me here today in the studio is
Rosalind Amaju Araro.
Yes, she's our in-house naturopath. And together, both of us are going to be dealing on the topic, causes and treatment of infertility in men. We did causes and treatment of infertility in women in our last program. So for those of you who are interested to know, we talked even about natural causes or natural remedies for fibroid in women, which is really predominantly a Black woman disease. So if you are interested to know about causes and treatments of fertility in females, you can check out our last post. But today is men's forum. So we are here to talk about it. Now, let's go straight to the point. Now, who are the men who actually need to see a doctor for infertility? One, they are men who have erectile dysfunction. When you go to see a doctor, you will be told why this could hinder your aim or your dream of becoming a parent and how the problem is going to be solved. Another one is a man who has been living with his wife for 1 year and they have been having regular unprotected sexual intercourse for a period of 1 year, and both of them are willing and want to reproduce or conceive, but it has not happened. Now, this kind of a man, it will not be out of place for you to go see a doctor and complain that you have been trying to conceive and it's not yet achievable. Now, another one is men who have problem with ejaculation, such as maybe retrograde ejaculation or delayed ejaculation. All of them, they need to go and see their doctors and get checked out, because these are very important causes of infertility in Nigeria of today. Another one is males who have low sexual drive. See, there's a woman has a fertile period, and with a man who has a low sexual drive, he's not feeling like having any sexual relations with the wife at that time that she's ovulating. That month may pass, and before you know it, a month, 2 and 3, 1 year elapses without them achieving their vision or their aim of becoming parents. So men with also low sexual drive should also see their doctor, because it can have physiological or even medical causes. Another category of men who need to be checked out for infertility are men who have pain or swelling in their genital area. That place is supposed to be pain and swelling free. So if such is noticed, they should also report to a doctor. Another one is if a male has previously, even before marriage, undergone any surgical procedure around the genital area, you also need to see a doctor. If you've been trying for a while, at least a period of 1 year to conceive, and you have not achieved that, you should see a doctor. Now, when you go see a doctor, your doctor is going to check out the overall health, because he's a wholesome individual, a healthy individual from head to toe that is able to impregnate a woman. So you need to be checked out, and then they now take your reproductive history, your sexual history, and then do some investigations until they pinpoint where the problem is coming from. Now, let's just take on some of the causes of male infertility, because today we are dealing on male infertility. Number one cause of male infertility that we can talk about is effective production of sperm. If anything happens along the reproductive tract and the sperm is not produced or produced suboptimally, this is also a problem with reproduction. Another one is men who have count problem, low sperm counts, men who have it. This can also cause infertility. Another one is movement of sperm. If sperm is not supposed to be idle, that's not the way nature makes it. When a sperm is one single sperm cell, if you look at it under the microscope, it wiggles, that's what we call it, and then it moves. And as it moves, it's wiggling. So when you see a sperm that is just wiggling and not moving forward, there's a problem. If you see one that is just standing there and not wiggling, there's a problem. So if this is noticed, this is also can be a cause of infertility and should be further investigated. Another one of the causes, these are the 3 major causes of male infertility. Now, let's look at males who there's nothing wrong with you yet. You are not married, or you are married, or you don't even have the desire to have children right now, but you are at risk of having reproductive problems later in life. How do you know that you are at risk? First, risk factors for male infertility. Number 1 is older age. Males who are getting older, of course, you don't expect a man who is 80 years old to be as fertile as a man who is maybe in his 40s or 30s or even 20s. Another point is men who smoke cigarettes. There's what we call pack cell years. Men who smoke. Some men even do like 3-4 packs of cigarettes a day. Such men are at risk of having reproductive problems when they eventually desire to have children. Another one is heavy use of alcohol. Mind my language, heavy use, because actually it has been proven scientifically that moderate intake of alcohol is actually good for the heart. Now, when you now binge drink on it, when you now splurge on alcohol, now that's when it becomes a problem. Now you are using alcohol heavily on the system, and the system invariably will tend to react in various ways. And one of the manifestations will be inability to have a child. Another risk factor is also when you are when you are exposed to certain chemicals, maybe because of your work or anything that makes you, or even medical investigations that will expose you to certain chemicals like pesticides, herbicides, and heavy metals. Heavy metals like aluminum, lead, and all of that. Some people can be like, I don't do any work that exposes me to that. Where could this have accumulated into my system? That's what we said when we are talking about Salad Master. Salad Master is actually a company that owns or manufactures cookware made with titanium. And titanium, as we know it, is an element that doesn't react. So when you've been eating food all your life that is being prepared in aluminum pots, in stainless pots, metal pots, all of them can, over the time, accumulate in your system and cause reproductive problems. Now, these are the risk factors for men. Men who do this, they might not be looking for a child presently, but it might pop up later if this one of these things I pointed out is their lifestyle. Another one is medical conditions. There are some medical problems that you have that already, without you asking for it, predisposes you to becoming infertile in the future. One of them is when you have something like diabetes. Diabetes already, it affects the nerves and the blood vessels. And you never know which blood vessel and which nerve is going to affect. If it happens to affect the nerves and blood vessels located in the genital area of a man, then that man might likely have a problem with sperm production or any other thing. So this is one of it. Another causes, medical causes, is medications. Maybe, and even medications you take for diabetes also can affect the sperm count. Another one is chemotherapy or radiotherapy for male patients who have cancer. Now, this one is not, you didn't do anything, there's nothing wrong with your lifestyle, but you happen to have a disease, and in your course of trying to treat it and make it right, you will also, these chemicals and radiations can affect the genital area and then cause fertility problems. So the other one is the drug that we use, some of the drugs that we use for rheumatoid arthritis. They can also affect the sperm levels. Also, there's a particular group of hypertensive drugs that can affect fertility. We call them calcium channel blockers. These calcium channel blockers, example is nifedipine. When you take it for a long time, it also starts to cause erectile dysfunction. So this is a side effect of drug causing another disease. So like we always advocate for diseases like diabetes and hypertension, the best treatment is prevention. Another one is tricyclic antidepressants. These are drugs that are given to people who are depressed to help them regain, come out of their depression. One of the side effects of these drugs also can cause reproductive problems. We have men who go, this is now a lifestyle problem, who want to go to the gym and have six packs. They are not, they might now go a step further, not only to gym, then they have what we call steroid drugs. They will be taking those steroids to make them have bulging arms, six packs, and flat abdomen. Well, remember that while you're at it, you are also going to affect your reproductive system later in life. So these drugs are really, really not advised for people who want to just build up their muscles. You can actually build up your muscles naturally without using steroids. But if you do use steroids, just bear it in mind that you're causing havoc in your reproductive system. So we also have some drugs, like some recreational drugs like cocaine and marijuana. They also affect the reproductive parts of it. So, Ma'am, do you have what do you want to say to us at this stage?
Thank you very much.
Yes.
From what I can gather from what you have said so far,
Yes.
as a medical person,
Yes.
is that some of the causes of infertility in men has to do with introduction of chemicals into the body.
That's right.
Some of them could come from the food you eat.
Yes.
Some of them could also come from the
cookware
that
you
you're
use
using
to prepare
the food.
Yes.
Some of them could come from, maybe where you walk,
yes,
the environment,
toxins you're exposed to.
Yes. So now, again, we're saying that in naturopathy, what we try to do is to treat any kind of disease, whether it is male infertility, whether it is diabetes, whether it's high blood pressure, whether it's hypertension, whether it's any of the LSDs, the lifestyle diseases.
Yes.
Every sickness of all this I just mentioned, they have something in common, and what is it? Is our food.
That's right.
Is our food. And so for the male person that is infertile and is looking to be fertile, to impregnate his wife and have children,
yes,
we need to run away from the things that will introduce chemical substance into your body.
That's right.
As we say in naturopathy, the cause of diseases is accumulation of unwanted toxic substances,
yes,
and then contamination of the blood. All of this comes in through what you eat and what you take in. And so, as much as possible, we need to go back to nature.
That's right.
You also mentioned again too that steroids, excessive steroids in the body will lead to infertility in men.
Yes.
And a lot of us feed on meat.
That's right.
Red meat.
That's right.
Even, and all of this, they already have steroids in them. So you now take the steroids into your body, it affects the male reproductive system.
Yes.
So I think by the time we begin to talk of how we'll address how do we treat male infertility naturally or by
going the orthodox medical way.
Then we'll deal with all of that as we proceed.
Okay. Yeah. So now, how do we treat? First of all, diagnosis for male for the cause of infertility starts with, like I said yesterday, starts with semen analysis. In your semen analysis, there are so many parameters that we look at. So it involves semen analysis. Before you go to a hospital, a doctor will first of all tell you to abstain from sexual relations for maybe 3 days. And then you come to the hospital and you produce your sperm. When you do that, it is taken into the laboratory and then looked at under the microscope. One of the parameters that is being checked is this count, sperm count. Is it low? It comes in millions. So depending on how many millions you have, we know that whether you have a low sperm count or the sperm count is normal. That is the first thing. Secondly, is we look at the morphology. Morphology, simply put, is the appearance of the sperm cell. There's a particular way in which a sperm cell is designed to be. It's designed to have a big head and a tail. It's the tail that wiggles when it's moving. So now, some of the sperms can have 2 heads. Some can have 2 tails. Some can come without a tail. So all the difference in their morphology is what causes it to, when you look at it under the microscope, you can be able to say, okay, this is a good sperm. This one is not good. We can work on this. We can place him on certain medications, certain diet, and then work it up maybe for 6 months and then see the improvement. Another parameter also, the sperm count, this semen analysis looks at is the motility. First of all, like I said before, sperm cell wiggles. It doesn't stay one place. No, it's always moving. It's always active. And then the movement is always upwards and mobile. It moves forward. So now, if you see a sperm cell, now this is where it's facing and it's going sideways or backwards. There's a problem because that is not the way it's designed to move. So that is one of the things that we assess during semen analysis. But that is not for the consumption of the patient, it's for consumption of those people who are in the laboratory who will look at it. But at the end of the day, they will come and tell you what their findings were. And if there's a problem, you now take it from there. Because first of all, for you to solve any problem, you need to know that it is there. Now, again, in treatments of infertility, you don't just treat infertility like that. There are so many things that come into play before you treat fertility. Number one is the cause. Do you know the cause? Because we want to know the cause, that's why you are subjected to a whole gamut of investigations, including testing for hormones, X-rays, and all of that, to find out actually what the problem is. Another one in which you look at before you say, okay, this is the kind of treatment a patient will undergo is two, if you have been trying, how long you've been trying to conceive matters a lot in the treatment of infertility. If you've been trying to conceive for 1 year, yes, it's a problem, but it's not an alarming problem. You can't compare it to someone who has been trying to conceive for 18 years. So the kind of urgency you give to both cases must really vary. Another one is the ages of both partners. The age of the male and the female, both of them are equally as important. Another one also is personal preferences of how you want your problem to be tackled. There are some people that they don't want anything surgical. Some others, they want medications and all. So your personal preference will come into play in choosing the type of treatment that will be given to you. Then the last but not the least is the overall health of both the male and the female. So if you have any underlying problem, any underlying medical issue, it must be trashed out before you embark on your fertility journey. So that is it. Now, how do we now do it? Male infertility, like I said, can be treated in a variety of ways. First of all, the first one you can do is you can do medications. There are some kind of low sperm count that medication can also help to boost the sperm count. Another one, not only medication in this case, but also nutrition. Nutrition can help to boost sperm counts. Like she said, if you really contribute or go out of your way to go back to nature, go back to basics, eat natural things, fruits, vegetables, nuts, and seeds, they also help in boosting sperm counts. Another one is also not only another one is also medication. You can also use medication not only to boost sperm count, but also to treat infections. Let's say there was a sexual transmitted disease already in one of the partners. Before you even do anything, it must be treated. And this kind of disease doesn't require surgery. It requires medication. You'll be told what medication to take, how to take it, and how long you're going to take it. And when that is cleared from the system, then you can embark on your journey. Another method of treatment for infertility in men can be surgery. Yes, surgery can be done for men. For example, men who have varicocele, your doctor just checks and say, okay, the diagnosis is varicocele. Varicocele is not something that can be treated with oral medications or any other. It has to be surgically removed, and that is one of the cases in which you need to do surgery. But there are some other cases also which surgery can correct. Depending on what was found out during the investigations and what you present with, that is where a doctor decides whether you need a surgery or not. The last but not the least is what we call assisted reproductive technology. A male can also be treated using that. We have, under this area, we have what we call the IVF, that is the in vitro fertilization, or we have the intracytoplasmic sperm injection. In this case, the sperm is there, it is healthy, but the motility is not optimal. And you have given drugs, given food, given everything, and it's not working. What you do is that you get the sperm cell directly, draw it out with a syringe, and go and just inject it into an egg for fertilization to occur. So this assisted reproduction, it is really assisted because it is happening outside nature. This technology involves getting the woman's egg and the man's sperm and then fertilizing them outside the body. When they reach a certain stage, usually the 5th day, the the fertilized egg is now transferred to a woman's body. That is basically what IVF is, and it can be used to help some men who we've tried maybe medication, surgery, and all of that, and it didn't work. Then that is a means that can be used also to help.
Well, I just wanted to ask to, you have said that IVF.
Yes.
I know that I don't know how expensive or how, what the cost is, for IVF. And then from what you have said to us about if we had prevented all these causes, wouldn't that be better?
Yes.
So that we don't
Yes.
get into the state of having to.
Yes, assisted reproduction, no doubt, has its very good uses. It has cleaned the tears from so many couples' faces. But then it has its own disadvantages too, because first of all, it is very costly. Not everybody can afford IVF. Secondly, some of the things done during the procedure, it is painful. So if there's any other way in which you can achieve becoming a parent other than IVF, I think it should be encouraged, especially if it's just you going back to nature, eating the fruits that nature has made available to us, doing things, avoiding certain kind of harmful lifestyles like excessive use of alcohol, and taking some recreational drugs like cocaine, marijuana, and then smoking too much of tobacco. In fact, infertility is not even too much. If you are intending to be a parent and you have been trying to conceive and it's not possible, it is better to just stay away from cigarette smoking.
I just want to, add here to say that we can, with nature, you can prevent and you can even reverse some of the diseases or the lifestyle diseases or even infertility.
Yes.
With the right kind of food, taken with the right kind of environment.
Yes.
You can prevent.
Yes.
And then you can reverse, the infertility situation in a man.
That's right.
Can be addressed.
Yes.
Without what I'm trying to say.
Yes.
And then if you do not want to go through the painful procedure of surgery, and then again the cost.
Yeah,
you can address it through nutrition.
Yes.
Through your diet.
Through diet.
So we're going to be looking at that deeply as we proceed.
So now that brings us to what I call infertility and natural treatments. Are there natural treatments for infertility? Now, let me tell you, in 2018, there was a review carried out world over, and it was discovered that 29% of couples have, at some point in their quest to have children, used natural means to try and see whether it will help. Yes, so there are so many natural means in which you can help yourself to improve your fertility status. It is very good because one of the things I said here previously was for you to be able to conceive a child, the overall health of both the man and the woman must be optimal. So eating right, eating natural, and eating healthy is one of those things that will get you in that state of wholesomeness in preparation for conception. Now, there are several ways in which you can use natural treatments to boost your fertility. One of them is what they said in the text that was the review that was done. They included acupuncture. Acupuncture was there, yoga was there. And I got curious. I went in, I was like, how can yoga help fertility? Yoga is just a form of exercise and breathing mechanism that helps you to distress yourself. Now, every couple who has ever experienced the pain and the shame of infertility knows that the stress is not a joke. So if you include or incorporate yoga into your daily activities, it will help you distress. So that one is striked off the list so that you can face other challenges. Acupuncture too. Acupuncture also helps you distress and also should be encouraged. Anything to get you in a very good state of mind at this point in time is encouraged. And these are natural means and natural ways to help you achieve it. Now,
I think massage.
Okay,
Also,
yes,
massage also can help you,
yes,
take away the stress. And then even in the process of massage, the reproductive areas, in male and female,
yes,
can also be massaged so that the blood can flow easily,
exactly.
and even the sperm and all of those things can flow very easily. Massage also helps to improve the digestive system.
Yes.
Because all of these things
getting nutrition to various organs.
You may be taking in
the
nutrition, but it's not getting to where you should get to. So
that's right.
During massage, it helps to
improve circulation.
Exactly.
Yes. Wow, that's a wonderful one. That's very wonderful. Because I was thinking massage that is just to distress, but now from what Madam Roslyn has said to us, as the specialist in naturopathy that she is, which I'm not, she told us now that it can help you actually in circulation, improve circulation of blood and nutrients through distant organs and tissues that normally might not have gotten it if you didn't massage. So massage is really recommended. Another one also is we're still coming down to food, because the body is like a computer. It is garbage in, garbage out. It is what you put in that you get. So in this area of fertility, there are some micronutrients and macronutrients that are very important. Now that brings me to various vitamins that are very, very important, and minerals that are important in promoting healthy sexual reproduction. Number one is folate. Folate, it's when you have folate in your body, it goes to help you in the manufacture of red blood cells. Of course, for a woman, your womb has to be well vascularized. The amount of blood that comes to a womb every hour is like 500 mils, which tells you that nature makes this place to be well vascularized so that blood circulates here freely. It is very important for implantation of a baby and everything. Baby needs to implant. Babies implant on a bed of blood, which the uterus provides. So you need folate in your diet so that you make that blood cells available. Another one is zinc. Zinc is very, very important. As we all know, zinc also played a very huge role in immunity. It boosts your immunity. So at the time you're trying to conceive is not the time that you would like to come down with any kind of infection. So zinc is there to help boost your immunity. So when you now go shopping and you now go for things, you look for things that contain zinc. It is very, very important. Another one too is vitamin C. Vitamin C can be gotten from oranges, in fact, the citrus family, oranges, lemon, all of it, grapes, you can find it there. So it is advised to go on those natural food and fruits that is locally accessible to us, and they are cheap to help you improve your fertility. Another one is vitamin E. Vitamin E is very, very good. It is very good in protecting the cell, of the eggs, sperm cells, and then the ova or egg of a woman. It protects it. That's the work of vitamin E, protecting the integrity of the cell. That's what it does. And it can be gotten from a lot of food, example, sardines, all those oils. They also contain vitamin E, omega-3. It's very good for reproduction. Another one also is iron. Iron is also it also helps us in the manufacture of blood, just like folate. So iron now, you get them in, we get iron from vegetables, green leafy vegetables in the market. We get it in the market. Then folate also, we get folate from meat. So now that is the problem of those ones who are vegetarians. People tend to think that they'll miss the folate from meat, but they are now plant sources of folate too. So if anyone who is interested in improving his fertility profile by non-invasive and natural means, these are the food that you should be aiming for. You now eat with an aim. You don't eat anything now. You don't eat anything that you see. You eat for a reason at this juncture. So now we now come to natural means of treating.
Sorry, so we'd like to look at some of the food that has this vitamins,
yes,
and minerals,
that's
and
right,
nutrients that you have just
mentioned.
Because as I said before, what the body is asking for is the vital force. And this vital force, you get it from your fruits and your vegetables, which have not been over-processed. So you still retain the vitamin E, the vitamin C, the potassium, and the zinc, and all of them.
Folate and iron.
Yes. So you need to, as I said, as we were talking yesterday, we said we can't be eating all our food raw all the time.
That's right.
And so because we are used to cooking our food. So all of this organic food that we have gotten, your avocado, your bananas, your citrus, your potatoes, your tomatoes, which are high in potassium.
Yes.
If you overcook them, in the process of cooking them, you will destroy the vital force.
That's right.
Which is called the phytochemicals. They are called the phytochemicals in the food. So we need to be conscious of that. You might have gone out, okay, now they told me, yeah, Dr. Dolly has said to me, if I don't want to do IVF, it's expensive. I don't want to do IVF. Let me go the natural way. I'll now begin to eat potatoes and avocados, bananas, so I can get my potassium. And I'll begin to take I want my vitamin E. I'll be taking my whole grains. Yeah. I'll take my nuts and my seeds because I want my vitamin E from them. Also, if I want my vitamin A, I'll begin to look for fruits that are, things like carrots.
That's
right.
Carrots,
you have vitamin A, you have your green leafy vegetables. In fact, your mango leaf.
Wow.
Any green tea.
Yeah.
But rather than go for processed green tea, you have green teas all over. Your moringa tree is highly, highly very nutritious. And it also helps in the treatment of infertility in both men and women.
Female.
Yes, both men and women. And even your mango leaf.
Wow.
So really and truly, instead of looking for processed green leaf, because I know there are so many packages of green leaves if you go into the stores and all that, go to the nation, it's all over the place. And then your fibers, you can get your fibers from your oatmeal, your fiber from oats, from your legumes, your beans, and all of those things. But then again, the issue here is if you over process this food, you kill the nutrients and the vitamins, and you're just eating. End of the day, you say, oh, but Dr. Dolly told me that I should look for this in fruit, and I've been doing it, it's not working for me. No, it is not working for you because you're not eating the food in the right way.
And not preparing it right.
Right. So
watch the cookware you use to prepare food. That's why we still advocate Salad Master's cookware is still the best. It has titanium on it, and it doesn't rust, it doesn't corrode, it lasts forever, and it doesn't react with your food. That's a very important point. Okay. So let me buttress your points. Like you said, the green tea. Yes, and I want to let our viewers know that green tea contains what we call antioxidant compounds. And now these antioxidant compounds help both male and female. But since we are dealing with male infertility today, it helps specifically in sperm motility. Yes, it helps, and then it also increases the sperm count. So it works. So like she said, green teas like moringa, which other one?
Yes, we have a green tea,
yes.
Your guava, yes, your guava leaf,
all of it. They contain the antioxidant compounds that helps to boost the sperm count and motility. So that is that. So we have what we call fertility diet. You can actually place yourself, like we said yesterday, for you to be diagnosed or that you have infertility problem, even before going to a doctor, you should be able to go to a doctor, not only meet your doctor to find out what is causing the infertility, you should meet with your dietitian. You should meet with your naturopath. you should meet with your nutritionist so that they will, together with your both of you, come to a conclusion on how to make fertility diet for you. It is really at this point that you now start eating for a reason. Start eating with an aim in sight. You make fertility diet plan and you try as much as you can to stick to it. So when you're choosing your carbohydrates in this fertility diet plan, you choose it wisely. It's not every carbohydrate now that is good for you. Or like we said, we can do whole grains. Those are carbohydrates that are very good. You avoid trans fats. Any trans fat means fat and oil. Oil is supposed to be liquid at room temperature. So any oil you get that is solidified as room temperature has been hydrogenated, which means the oil has been in the factory processed and then they added hydrogen to make it solidify. And that thing that is solidifying the oil at that point, it is not good for you. So you can see it in margarine, butter, and all of that. So this is the time to avoid stuff like that. And that's it.
So, so just to further, throw more light on what she said about the fats and oil. Really and truly, we really don't need those fat and oil. Yes. Any oil that has been put on the fire, let me just bring it down to the basics.
Yes.
And it's cooked, you've changed the molecular structure of that oil.
Yes.
So right. It's now becomes saturated fat. And if you take that fat into your body, the body cannot really recognize it. So what it does, it goes to store it in different areas of the body.
That's right.
For example, the most delicate one is the artery walls.
Yes.
You clog the artery walls and it comes, gather in your hip, gather in all of those places. So as much as possible, run away from fats and oil.
That's right.
Fried food, anything that goes into, in fact, by the time you even begin to fry your food, you like wrapping your food in an oil bag.
Oh my God.
Yes. So first of all, the system has to deal with the oil.
Digesting
it first,
yes.
before it now gets even to the food
itself.
Before it gets to the food. So, and then that takes the reproductive system, the digestive system.
It takes a toll.
It takes a toll on the digestive system.
Over time,
time, exactly.
Yes.
Ideally, it should take about 8 hours.
Yes.
For your food to digest and follow through the digestive system for you to eliminate the unwanted product.
Yes.
So as much as possible, let us run away from free radicals.
That's right.
And you get these free radicals from your
fat
consumption, and all of that.
Yes. Thank you, Ma. That was very insightful and very informative. That when the free radicals, as she said, is all the food, the saturated fats you get into your system. When the body is metabolizing it, all the hydrogen that is added on those fats to make it solidified at room temperature so that you can buy it and it will be attracted to you. Those ones, when the body comes, the body now unwraps the oil around the food for it to get the food. When it gets to the food, it will now start the metabolism proper. And now the metabolism, we now have what we call free radicals. Those are the unwanted part of the food that you ate. And the body having no place to store the free radicals, they are randomly stored in the body and they are not supposed to be there. And over time, if you continue with this unhealthy diet, over time, it will develop into something else. And infertility is one of the offshoots of this unhealthy feeding. So today, we said yesterday that we will attend to the questions where we were not able to attend to yesterday. And one of the questions that we had is, a woman was asking that I have had a child previously in the past, but on subsequent trial, she wants to conceive also and have more children, but has been having difficulty doing so. Now, can she be termed or can she be called infertile? No. Now, In infertility, in medicine, infertility is broadly classified into two types. We have what we call primary infertility and secondary infertility. In primary infertility means that this is a woman who has never conceived in life before. Now, secondary fertility means that this woman has at some point in her life gotten pregnant, which it can result in miscarriage, it can result in anything, but she has ever been pregnant. So now this woman is classified as having secondary infertility. So it is not proper for such a woman to be termed infertile. No, you've already had a child previously, so you're not infertile. So that's how I see it. So the other question says that
don't you want to maybe address the issue? What causes a secondary infertility?
Yeah. Oh my God, secondary infertility is a whole broad topic, but the main thing, or the one I would like the viewers to take home, is one: primary infertility can result from secondary infertility can result from delivery, the last delivery you had. Because doctor will ask you, okay, you have given birth before. How did you give birth? They said, I gave birth vaginally. Did you bleed? He said, yes, I bled. How much did you bleed? This one, we call it Sheehan syndrome. If you bleed too much during delivery, it goes off to shut off the some parts of the brain, that's the pituitary gland, that is the part of the brain that regulates fertility and releasing of egg. So when this is done, in order for the body to compensate for itself, it shuts down some places, and this is part of it. And then in subsequent pregnancies, the woman cannot be pregnant because she is not releasing eggs. The brain, the center of the brain that regulates the part of reproduction has been shut off due to excessive bleeding during the previous delivery. Then there are so many things. You can have also infections, which you didn't have before you delivered this child, and then you now have it. It goes around to block the fallopian tube. And so there are a whole myriad of problems that can come. You can also have what we'll call, although this is not really a problem of Black women, we see it more in whites, but then you can see it in Black women who have undergone fibroid surgery or myomectomy. You call it endometriosis. Endometriosis can also cause, maybe you have delivered and then you have fibroid surgery and then you're trying to deliver again and there's a problem. It can be one of the causes. So basically that is it. So maybe we will do another topic on just causes of secondary infertility so that women will know. So another question we were asked yesterday was, can stress cause infertility? Can stress cause infertility? No doubt, stress is one of the major causes of infertility. Yes. And if it is not, stress can also be one of the major causes that prolong infertility. If you are supposed to be infertile for maybe like 2 years, because you're stressing about it and people are stressing you about it, you will now prolong the infertile period because you are stressed. So that is why we also, at the end of the, when we're discussing treatments, we talked about yoga, massage, and all of that helps to relax you and distress you. Yeah. So let's look at how stress can cause infertility. First of all, stress is a mental thing, and mental is brain. And the brain, the part of the brain that controls, see, the reproductive organ is down below, but the main control is in the head. So the pituitary is the main organ in the head. The hypothalamus then sends message to the pituitary, and it is the pituitary gland that now sends message to the reproductive system. Now you're seeing it. It is from hypothalamus, pituitary, and then reproductive system. If anything happens to the hypothalamus, the whole reproductive tract is shut off. You can't get signals, you can't get nothing. You don't ovulate, you don't menstruate, you don't do anything. Now, if the hypothalamus is left and then something happens also to the pituitary, also all the things is controlling, all the reproductive tract is controlling, also shuts off. So stress can actually shut off the hypothalamus, making it difficult or almost impossible for you to release eggs. And without a woman releasing eggs from the ovaries, even if the sperm is injected into the reproductive tract, fertilization can never take place. And once there's no fertilization, there will be no pregnancy. So that is a way that stress knocks off or adds to infertility or can cause infertility. So this program, I want to use this venue to advocate to people, mother-in-laws, sisters-in-laws, friends, neighbors, people who know people who are trying to conceive, to not to add to their stress, because that state already is a very stressful thing. Now you imagine their friends, their neighbors, their co-workers, mother-in-laws taunting them. You are a man, you cannot give birth. You will be calling a man, you are a woman, you cannot give birth. It can happen to anybody. And when it does happen to people we know, we are urged to please be human and put ourselves in their position and know that if this is done to us, it will not be good. And what surprises me most is that when my patients come crying to the hospital, it is usually the female members of their family that taunt them the more. A woman has not conceived, the mother-in-law will see. You don't need to insult anybody to let them know that they need to do something about having a child. You don't need to heap insults and heap blames on them, because some people I know have been pushed to suicide. Instead of you now having a child, you now go and kill yourself. So we as a society, we are in this program, we're begging us to be humane, to be tolerant, to also accommodate them and know that they are passing through a lot. Any patient, because any fertility clinic, that's why it is required that any fertility clinic must have a counselor. They need to unburden their hearts. They need to talk about it. They need to be comforted first and foremost. They need to be distressed before they even embark on their fertility journey, because you can be 100% healthy physically, but if you're mentally unfit, you still cannot be able to conceive.
I think once again we need to give a kudos to Salad Masters for
Yes.
giving us the opportunity to because
bring this program.
yes, because I think this is part of what's the corporate social responsibility
Exactly.
of Salad Master.
Wow.
And even Shekina Investments that is
Wow.
in number 2 Alexander
Ikoyi.
Ikoyi.
Yes.
So our doors are open.
That's
you can come
right.
for free counseling. And
wow, that's beautiful. That is
because
beautiful.
we know what it is really
Yes.
for people to be going through this, the stigmatization
Wow.
of fertility and all of those
Wow. So viewers, you've heard what our mommy said. If you want to see, she's a very big woman. It is just the social corporate responsibility that is making her throw her doors wide open to people who need to be cancelled. So you can come to her. She's a mother. She has seen it all. She's a mom, a lovely mom. She's a wife. She's a sister, and she's been a co-worker, and she has seen it all. So for those of us who I don't know who to turn to, I don't know who to confide in, and all the people around me are making mockery of me, please contact us so that we can tell you how to proceed. That is what we have to say. So, Mr. Marvel.
Hi. Wow. Guys, it's been amazing today. I must say that the session is mind-blowing and very, very informative as well. Thank you very much, Dr. Dolly, and thank you, Madam Rosling. Thank you, Salad Master, and thank you, Shakina Investment, for actually letting us come to Ikoyi. We're streaming from Ikoyi today, so just in case you can pass by and actually stop by Alexander, number 2. That's where we're streaming from today. We have just a couple of questions. I'll just read out quickly. The first one, lots of people are connected on YouTube at the moment, and they are enjoying the show. Someone says, thank you for this session. Thank you, Dr. Dolly and Madam Rosling. It's been very informative. I have another person say, Dr. Dolly, can you just give an explanation of the secondary infertility causes by bleeding in previous childbirth and solutions, if possible. Yeah, I hope you got the question. I'll just take it one more time. I'll just take
Okay.
it one more time. Now, it
Okay.
says, can you please give an explanation or analysis on the secondary infertility causes by bleeding in previous childbirth and solutions if possible? So I'll just let you take that question. We have another one, and I'll come back and read the other question out.
Okay. So, like I said, secondary infertility, it is the infertility that occurs when a woman has previously conceived. She has been pregnant in her life before, or maybe it was terminated, or it was miscarried, or the baby was given birth to and then died at delivery, or the baby died while still in the womb, or the baby has been born, lived for maybe two weeks, 2 years, and dies. Or the woman has delivered the baby is alive, doing well. But after conceiving for that first child, subsequent pregnancies has proved abortive. So there are so many things that can cause it. Like I said, it's a huge range of topic. If we have to dive into it today, we will not go. But let me just sketchily say this. First, number one cause of secondary infertility is one, any doctor will want to know the circumstances surrounding the first delivery, how it went. Usually, the cause of that secondary infertility might be pointed to the delivery. Maybe the woman delivered in a primary health care without adequate medical attention. So it is one of the things that can happen. Another one is that commonly happens is infections. Sexually transmitted infections can block a previously open fallopian tube, making subsequent fertilization impossible. Another one is maybe, what do you call it? Surgical procedures, like I said. Surgical procedures. Maybe you have done, you did, maybe you had acute abdomen and you were diagnosed to have acute appendicitis. If the appendix is allowed to burst inside a person, it has consequences, and infertility is one of them, which means it never happened before you gave birth and now it has happened. So it has happened. So you also need to take note of that. Another one is in the course of myomectomy, in the course, maybe you have given birth before, and then subsequently it was discovered that you have fibroid in your womb. Now, some fibroids can be there because they are small, and because of the position in which you find them, they are okay for conception. It doesn't disturb conception. But there are ones that are sitting right at the bed, at the implantation bed. It has to be removed. And then when you remove it, there's also consequences, because we have what we call adenomyosis can occur, which will now have to hinder further conception. Another one is also what we call adhesiolysis. Because you had myomectomy before, the womb will heal, but it will now gum together like this. It's supposed to, the womb is supposed to be patent like this. There's an opening, and on this is where the baby will implant. Anywhere around here, baby implants. But when the womb is gummed together, because there has been a procedure on it, maybe surgery or anything, or even you inserted IUCD, or you were trying to terminate a pregnancy and it came and gummed together like this, that woman will obviously have secondary infertility, because there's no room for any fertilized egg to implant. So this is the much I can take from this topic, because it's quite a huge topic. If we have to dwell on it, we will not end here today. But I hope I did justice and I explained what the person wanted to know. And it is actually treatable. It is really, really very treatable. If you notice it, just go to your doctor. Most of it is actually treatable. For people who have secondary infertility compared to primary infertility, secondary infertility is more responsive to treatment than primary infertility. Thank you.
All right, thank you, Dr. Dolly. Thank you so much. That was very, very precise, I must say. Just moving forward, someone says on YouTube, thank you, Madam Rosling, your talk is an eye-opener. Thank you very much. Now, coming to Madam Rosling, you've talked about naturopathic science or medicine on the talk, which is great. I've learned a lot personally as well. But what's the connection between naturopathic medicine and herbal drugs? Now, when it comes to today's world, you have lots of people who take herbal medications when they have complications or when they are infertile, right? So how do we balance it and know the difference, Madam Rosling?
Yeah. Naturopathy also treat with herbs, because as I said, is, you know, from the name, it suggests nature, you know. So, and for herbs come from nature, and most of the herbs they all have medicinal value. Every of the herbs have medicinal value. In fact, there are certain herbs that you can put together to treat infertility, you know, and
wow.
yes, yeah, but we cannot go into all of that here just right now.
Yeah.
There are different herbs you put together to treat, you know, any kind of disease in the body, because what we get from the herbs is they are all high in antioxidants.
Yeah.
And the antioxidants comes in with different nutrients and vitamins that you need in them. Yeah. So herbal treatment, naturopathy treats with herbs, you know, because remember, it's an alternative kind of medicine which does not address drugs. So the naturopath treats with your diet, they treat with massaging, they do acupuncture, and they also do aromatherapy, and you know, all
and
of
yoga.
it, and yoga. So herbs and naturopathy go together.
Wow.
Okay, wow, thank you very much, Madam Rosling. Now, I know what Madam Rosling is actually saying again is that, you know, we have lots of herbs in society today. Everyone has become a herbalist. Yeah, so just go to a naturopath, talk to Madam Rosling. She would actually help you out in that direction. So thank you very much. That's all the questions we have, and that's the size of our show. From me, I'm going to say have a wonderful night and hand it back to Dr. Dolly and Madam Rosling to close up the show tonight in the studio. Over to you guys. Have a great evening.
Okay. All right, viewers, we are reluctant to end the show because it has been so engaging and interesting. But like all good things, this has got to come to an end. And from me, I'm saying good night and God bless.
Good night. God bless. Keep praying.
That's right.
Because prayer is the solution to virtually every problem that we have.
That's right. Good night.